though, we're joined by Dr. Chris and an astonishing scanning machine. And if everything that's being said about this machine is true, then this is quite a revolutionary step forward in scanning. Yeah,
it sounds very remarkable. A very sensitive machine that can detect breast cancers before mammograms can detect them.
And Dr. Nigel Eccles, you're here with the information. So can you tell us what does it do?
Sure. Basically, it's looking for heat emission from the body surface. And we've known for 40 years or more that breast cancers emit more heat than the surrounding tissue. So basically, the camera is a heat sensor or an infrared sensor. We're looking for heat differences.
And this can detect possible breast cancer, is this right, up to 10 years prior to the technology we have available now?
That's correct, 6 to 10 years before, because we're not looking for something that has to have a structure or size. We're just looking for increased metabolism or heat or new blood vessel formation, which is a process which occurs around all new tumours. And that's the process which is manifest as heat, which we can detect much earlier than something which has to be grape size.
We've got some shots here of it in action earlier this morning. Now this is in my dressing room. You were very kind enough to bring it in, so it's not strictly sort of medical temperatures, because this actually it's vital that the room that you are in is of quite cool temperature.
Correct. It has to be temperature controlled between 18 and 22 degrees.
Yeah.
And the temperature must be maintained during the scan, which takes about 15 minutes to do.
Right. And so when you see the results on the computer, what do the results actually look like? What can you see?
Well, I have an example of one on my a normal scan on my computer now. But basically, you're seeing. Well, here's an example that you can see on the screen. You're seeing different colours basically, and each one of those colours represents a different temperature. This is a normal-looking scan. Normally, heat would show as red, as you'd expect, or hot, and cool would be blue. So we're looking for, and each one of those temperatures, or rather colours, represents a particular temperature. The sensitivity of this equipment is down to 0.03 degrees centigrade. So that's how precise we can be in temperature differences.
Do you have any pictures on your laptop there?
I do.
Of a positive?
I have a picture of, the one that's on my laptop right now is a picture of a normal scan. So this is a woman who has a normal thermogram, normal breasts. And I also have a picture once. Yes. So here we are. What we're looking at, obviously right and left breast, you can see generally the breasts look quite blue and cool. That's usually a good sign. It means that there's no abnormal heat activity. And we're comparing one side to the other always. So, for example, we compare the nipple temperature on one side to the nipple temperature on the other. And the same for all the areas of the breast in each quadrant. So the inner, the upper, outer. We're comparing light for light, one side to the other. So this is a normal scan, lots of blue, no abnormal red activity. The other thing I should point out, if you look at this scan just adjacent to it, this is also a thermogram or a thermal scan, but it's on a different palette. It's on a grey palette. This enables us to see blood vessel patterns much more easily. And if we don't just look for heat differences, we look for abnormal blood vessel patterns. And it's important to do the two. What we then do, having taken the pictures, is we get a woman to hold ice packs for a minute and a half. Sounds barbaric, but it isn't. And then we repeat the same pictures again. The idea of that is that we present a fight-flight signal to the body. What happens to normal blood vessels is that they shut down or constrict or cool. But the blood vessels around a cancer don't have a normal nerve supply, so they don't cool. So what we're looking for are areas of heat difference which fail to cool after the culture. I can show you an example of
While you're finding that, the wonderful thing is that the mammograms, of course, are quite uncomfortable because you have to have your breast literally squashed between two plates. But this is standing in front of something that looks like a little video camera.
This is the camera.
It's basically just like having your picture taken.
So there's no pain, nothing intrusive.
No compression.
If you had a tumour that you hadn't detected, quite an advanced tumour, it would see that as well.
I'm going to show you an example of someone with known breast cancer, and you'll see instantly the difference.
What's interesting, you know, when cancer cells start developing, they produce their own hormone that creates new vessels to grow into them, to feed them, to allow them to grow. And of course, the increased vessels, increased blood flow, increased temperature, that's what the machine is detecting.
People at home are going to be screaming, right, where can we get this done? How much is it?
Well, at the moment, we're the only UK centre offering this.
You're in London?
We're based in London, in Harley Street. It costs £195 to have a scan, and that includes the 2 copies of the report. We are trying to create a precedent for this technology to be used alongside the conventional screening, for which it's been approved by the FDA since 1982.
You've got your positive.
Let's have a look.
This is an example. Sure. This is an example of a lady who has breast cancer, and I think you can see instantly. Remember, I said we compare one breast to the other.
Yeah.
We compare heat changes one side to the other. This is the side that has the breast cancer. You can see there's lots of heat, lots of red, compared to the right side, which is clear. And if you look on the grey scale here, it doesn't show very well, unfortunately, on this particular view, but there are some abnormal blood vessel patterns here. So we have a difference in heat, which actually does not cool after the cold challenge.
Yes.
So this is very clear.
Would there be any chance that you could use this on other cancers in the body?
It's a good question. There are 1,000 published scientific papers on breast thermograms, none on other cancers. But from what I've seen in my own personal experience, I think it will be applicable to other cancers. It's just the work hasn't been done and it hasn't been validated yet for other cancers.
Well, wouldn't that be wonderful if that was available to everybody, Dr. Chris?
Would this become available, do you think, on the NHS, given you're detecting cancers that the patient can't even feel, the mammograms don't detect?
Correct. I would like to think so. I think it should be available on the NHS. The advantage of this is it can be used in young women.
Yeah.
Mammography is not very good for young women because the breast tissue is too dense. With thermography, it doesn't matter what the breast tissue density is. So it's a great tool for screening younger women.
But also, it doesn't appear. I mean, the equipment itself is obviously highly advanced, but it's not an enormously expensive machine. You have a fantastic computer program and a sort of thermoimaging camera.
Absolutely.
Very affordable.
Very affordable.
Thank you.
Pleasure.
Thank you,
Very
Dr.
much
Eccles.
indeed.
That's wonderful.
Thank you.
Fantastic, Chris.
It is,
Thank you
yeah.
very much indeed.
And if you detect, you know, a hot area, then that woman is at increased risk of developing breast cancer.
That's exactly right.
Yeah.
And if you detect it so much sooner, then we can take action to prevent her going down the line into a full-blown cancer.
Yes.
Brilliant. Wow, that is amazing.